Hello again and welcome. Today I bring you another topic um, related to mental health condition, and it's bipolar disorder. Today we are going to look at bipolar disorder. And bipolar disorder is a mental health condition that is characterized by extreme mood swings, including episodes of depression, low energy and sadness, and there's also episodes of mania, which is high energy and elation. And these mood shifts can significantly impact daily life, relationships, and functioning. So you may ask, what are the causes of bipolar disorder? The exact cause, unfortunately, is unknown, but it is believed to result from a combination of factors. Those factors are genetic factors, biological factors, and environmental factors. And we will look at genetic factor, which is family history of bipolar disorder, which they say increases the risk, and also specific gene variations, which they also say contribute to the mental health condition which we're talking about, which is bipolar. There's also the biological factor, which is which is imbalances in brain chemicals, and which has to do with neurotransmitters like serotonin and dopamine and norepinephrine. And under biological factors again, there's also structural and functional brain changes. And for environmental factor, they looked at environmental triggers, which has to do with stressful life events. So that can trigger that disorder and could lead to the cause. And for example, it would be trauma, loss, or abuse. There's also sleep disturbances and substance abuse. So, with knowing the causes of bipolar disorder, let's look at some of the symptoms of bipolar disorder. Bipolar disorder is divided into several types, primarily bipolar 1 and bipolar 2, and cyclothymic disorder with varying symptoms patterns. So, manic episode symptoms talks about elevated or irritable mood lasting at least 1 week. And under this type of symptom, which is the manic episode symptom, you will see increase in energy and activity levels. You will also see decreased need for sleep. You will also see rapid speech and racing thoughts. You will also see impulsivity and poor judgments, for example, risky behaviors and excessive spending in individuals who are living with bipolar disorder. And another symptoms of bipolar is depressive episode symptoms, and the signs you could see is persistent sadness or hopelessness, fatigue and low energy, and you also have loss of interest in activities once enjoyed. They will also show signs of changes in their appetites or sleep patterns and suicidal thoughts or behaviors. And the third type of symptom is actually mixed episodes. So there is features of both mania and depression simultaneously. So, how does this affect individuals with bipolar disorder? So, we have the personal impact, which is strained relationships. It affects their relationships due to erratic behaviors or mood swings. So you can see like the relationship between a child and a mother, a youth and a mother, or husband and wife, it can affect the relationship because of the behaviors that they exhibit. And another impact is difficulty maintaining employment or academic performance. And there's also under personal impact, we can see increased risk of self-harm or even suicide. The second effect of bipolar on individuals with suffering from this illness is physical health. There will be sleep disruptions and fatigue, risk of substance abuse and addictions. And the third effect of individuals with bipolar is the social and financial impact. And here we see legal and financial troubles from impulse decisions being made, and there's also the social isolation or stigma. And diagnosis of bipolar disorder is important, but it requires a comprehensive assessment by a mental health professional, such as a psychiatrist or a psychologist. And this diagnosis can take various forms, including clinical interviews. And during these interviews, there's assessment for the symptoms, the mood, history of life events, and also there is family, medical, and mental health history that can be also looked at. There is the second form of diagnosis used is the diagnostic criteria, the DSM-5, and that looks at the criteria that the individual meets for bipolar 1, and that means that at least one maniac episode with or without depressive episodes, and bipolar 2 looks for at least one hypomanic episode and one major depressive episode. So there's also the third one would be the cyclomic disorder, which looks at chronic mood swings that do not meet full criteria for mania or major depression. So last but not least, we will also look at the physical examination, which is also part of the diagnosis. And what the physical does is that it rule out medical conditions or substance use that might cause symptoms. So in knowing this, we are going to look at treatment for bipolar disorder. Whether you know this or not, bipolar disorder is a lifelong condition, but effective management can lead to stability and improve quality of life. So, and how this can be achieved is through various forms of treatment. One of them is medications. So with medications, mood stabilizers are given to reduce the mood swings. And so there's antipsychotics medications that are also given that manage mania or mixed episodes. And there's also antidepressants used cautiously, of course, to avoid triggering the mania that we may not want them to experience. There's also another form of treatment, which is the psychotherapy. And in psychotherapy, there's cognitive behavioral therapy, and that helps to manage thoughts and behavior. And then we have the psychoeducation, which increases awareness of triggers and symptoms management. And then we also have the interpersonal and social rhythm therapy. And what that does is that it stabilizes daily routines and sleep patterns. So we also have to look at the lifestyle changes which is another form of treatment. And lifestyle changes includes regular sleep schedules and healthy routines, avoiding drugs and alcohol, and stress management techniques that needs to be used, like mindfulness or relaxation. And these lifestyle changes can help significantly. There's also another form of treatment which is called crisis intervention, and that has to do with hospitalization during severe manic or depressive episode to ensure safety for the individual and others. There's also suicidal prevention hotlines and support networks. So support network support network are great because we also have another form of treatment, which is the support system. And support system can include your family, your peer support, and also you can join a group, a bipolar support group, for shared experiences and coping strategies. So prognosis and outlook. So though we may think that bipolar disorder cannot be cured, individuals can actually lead fulfilling lives with consistent treatments and supports. And also, early diagnosis and intervention improve outcomes and stability significantly. So, in order for us to be able to support individuals, whether it be in children or adults living with bipolar disorder, we can help them to navigate the system. And resources for help includes the following: National Alliance on Mental Illness, it's called NAMI, and the website is www.nami.org, nami.org. We also have other websites that substance abuse and mental health services, which you can call crisis hotlines for suicide prevention, and also you can have a support group, and that person that you can talk to whenever you have feelings and you start feeling the symptoms of having that will lead to an episode. You can find that support person that you can talk to. So seeking professional help and maintaining a strong support network are critical steps in managing bipolar disorder effectively. So as I always say, having support and help to support individuals with any form of disability is very important. And we need to be supportive and be non-judgmental, and try as much as possible to lead them in the right path when it comes to navigating the system. They can see their doctor, you can lead them to a clinic, a therapist, a counselor. If this is happening at school, university level, there's always school counselors, and I speak from where I live in Canada. You can always visit. If you are a mom, a parent, you can visit the library, you can visit your healthcare facility to get more information. So I hope this was helpful, and I also want to take the opportunity to thank you, and I also want to talk to parents who have children with disability, that it's not the end, but with support, things get better. So I hope that this message has been helpful, And I wish you a great day, evening, night, whatever it is on your end. Thank you very much for stopping by and for giving me a listening ear. Thank you. Have a good day.